How is a TB skin test injection done correctly? Imagine getting a quick, simple shot that can tell you if you have been exposed to tuberculosis. That's what a TB skin test, also called the Mantoux test, is all about. To do it right, the healthcare professional starts by preparing the skin on your inner forearm, about 2 to 4 inches below your elbow. They clean the area with an alcohol swab to make sure it's sterile and free of germs. Once the skin is dry, they take a small dose of purified protein derivative, or PPD, which contains 5 tuberculin units, and load it into a special syringe called a tuberculin syringe. This syringe has a tiny, short needle, usually 27 gauge and about 1/4 to 1/2 inch long, perfect for making a shallow injection. Next, the professional gently stretches your skin tight with their thumb and forefinger. They then insert the needle at a very shallow angle, between 5 and 15 degrees, with the bevel facing upward. That's the slanted part of the needle. They carefully advance the needle about 3 millimeters into the top layer of your skin, the epidermis. As they slowly push the plunger, the tiny amount of tuberculin is injected just beneath the skin surface. You should see a small, pale, tense bump called a wheal, usually about 6 to 10 millimeters across. This indicates the injection was done correctly. After the injection, the needle is withdrawn gently, and the site is checked immediately. If the wheal isn't visible or is too flat, the test might be invalid and needs to be repeated at a different spot on your forearm, at least 5 centimeters away from the original site. The healthcare worker then disposes of the syringe and needle safely. You'll be advised not to scratch or tightly cover the area. The test site must be checked after 48 to 72 hours by a healthcare professional to look for any induration, which is a hardened, raised area. The size of this induration helps determine if the test is positive or negative. Getting the injection right is crucial because if the tuberculin is injected too deep, like under the skin, it can lead to inaccurate results. The goal is to deliver the tuberculin precisely into the skin's outer layer, where your immune system can respond properly. Remember, this test is a screening tool to detect latent or active tuberculosis infection, and proper technique ensures the results are reliable. Always trust trained healthcare providers to perform the test correctly and interpret the results. If you're scheduled for a TB skin test, follow their instructions and have the site checked after the appropriate time. For any questions or concerns, consult your healthcare professional for personalized advice.